we think of hospitals and other medical facilities as cold, stress-inducing places. After all, no one wants to be sick or find out they have a potential medical problem. This could lead to gaps in wellness, with people skipping hospital stays or missing doctor's appointments altogether. However, the medical industry is changing. Many facilities and hospitals are being designed with warm, inviting spaces. How does design and wellness go together? In more ways than one can think. First off, what is wellness? Wellness can be defined as a state of physical, mental, and social well-being, and not merely the absence of disease or infirmary. When designing for wellness, there are important factors to consider. First factor would be having excellent lighting, a spiritual or symbolic element, and access to art. Ideally, this access to art would be nature or calming scenes. When referring to designs in hospitals and other medical facilities, we're often referring to psychosocially supportive designs. Psychosocially supportive designs stimulate and engage both mentally and socially while supporting a sense of coherence to the world around us. Psychosocial design focuses on coherence in the physical world around us to create a stimulating mental environment. The aim of psychosocially supported design is to stimulate the mind, create satisfaction, enjoyment, pleasure, and creativity out of the environment around us. Psychosocially supported design is not the only idea floating around in design. A popular theory for design is Ulrich's theory. Ulrich's theory states the ways a designer can utilize the built environment to reduce stress by providing users a sense of control, access to social support, and access to positive distractions. There are several key points for Ulrich's theory. These include when speaking of psychosocially supported designs in Ulrich's theory, it is also important to keep elderly wellness in mind when designing hospitals and medical facilities. Typically, hospitals and other medical facilities are designed for a younger generation, yet typically serve a elderly generation. It is important to use the following supportive design techniques in order to support wellness for everyone. Elderly design principles such as increased lighting, less glare, thoughtful seating in hallways and entryways, increasing font, and a mindful color scheme in contrasting colors all help the elderly navigate hospitals and medical facilities in a more independent fashion. Additionally, things such as sound absorbing and sound reducing materials could also help the aging ear hear better and have a more calming experience. While designing for the aging, it is also important to note that the younger generation and those with disabilities also benefit in hospitals and medical facilities from this type of design. Can incorporate many different spectrums and dimensions of wellness. The first spectrum I would like to talk about is business. As people stay in a newly designed hospital facility with a psychosocially supportive design, they may be more apt to recommend it to others they know, or inform the doctor that they enjoyed their stay and for their next treatment would like to stay at that hospital. This can help hospitals by having more money brought to their facility and increasing their profit. In addition to the business spectrum, the art spectrum is also very important. Great design can inspire. Art within the hospital has been shown to reduce healing time and decrease hospital stay for patients. In addition, depending on the type of art, it can either have a calming effect or a mentally engaging and stimulating effect for the patient. This created a psychosocially supportive design. The last spectrum I would like to talk about is the scientific spectrum. The scientific spectrum and the hospital wellness also go hand in hand. Using different techniques such as the barn-style surgery facility, patients have better outcomes and have reduced infections. When designing for patient wellness, you're actually designing for hospital wellness because many of the infections and post-secondary problems that patients have can be greatly reduced. Finally, I would like to talk about the 8 dimensions of wellness in relation to hospital design. First off, emotionally, hospital design in a psychosocially supportive environment will allow for greater social interaction for the patient. This gives a greater sense of control and a greater sense of hope with their situation. In the financial wellness sector, staying in the hospital for less time will mean less bills for the patient and the ability to get back to work sooner. Socially, psychosocially design is all about having social interactions with not only other patients, but also with your own family members in private spaces that are comfortable for everyone. Spiritually, psychosocially supported design should also have symbolic gestures that are open to all religions. Also, this would allow private spaces for your own personal worship. Occupationally, we switch from patients to workers. In this, the hospital design supports the workers. It gives them more of a chance to have a less strain on their body. For example, nurses' stations are more strategically placed to allow the nurse to walk less and focus on patients more. Physically, these hospitals are designed with the patient in mind, giving a sense of control and a greater sense of freedom without having to call a nurse at every step. Intellectual wellness, these hospitals are designed for intellectual stimulation by providing art and green spaces, open light spaces for people to interact with and not be so bored within their confines of their hospital room. Finally, environmentally is also tied into what we first talked about. Environmentally, these hospitals have many green spaces that are accessible to patients, or green spaces that they can see from the windows if they cannot access the outside. The environments are calm, soothing, and the colors are focused on a palette that helps the patients get well and have a less stressful environment.